Let's talk about the impact of COVID. So, over the last year, COVID has dramatically changed the health landscape. So, how has COVID affected the campaigns or the programs that you've been a part of?
I wasn't able to go back to the indigenous communities because of the coronavirus. So I've only been able to go back 15 days ago. I went there only. So after 1 year. And when I asked them, if they notice any change with this coronavirus, they said, change? Not at all. We've always been the forgotten ones. We've never received any sort of protection from the government. So we've always been exposed, right? So we've always been exposed to any sort of diseases and we've always been vulnerable. So we've always had this risk of dying. But something that really affected them was the overload of information because it was too much information that they received and they were scared, right? Until they came up to this conclusion that they've always been vulnerable, they've always been at risk, and they've always had this risk of dying. So for the migrant women, the situation was more difficult because obviously they were unable to access any healthcare services because, for instance, in the big cities, Bogota, hospitals devoted their services to coronavirus. And also the fact that you are an illegal because you are a migrant, it doesn't give you any much access to healthcare. And in the conflict zones, these people haven't been able to get out of the communities because they have been besieged or sieged. So they can't get out of the communities.
Have there been any techniques that people have used to combat this that you've seen that have been particularly effective, or have there been any techniques that people have used that have not worked at all that you've seen be ineffective in these campaigns?
I think as a researcher, it turned out to be a great opportunity because it allowed me to identify women leaders in the communities. And back then I was working, or I have been working with the topics of migration and food security. And so when I identified with these women, because I wasn't able to go into the community, so I asked myself, so how am I going to interview these women or these people? So I identified these women, I worked with them, and they turned out to be super well, to do a great and outstanding job. They did a marvelous interviews of the people. And I think that this gave me an opportunity of finding a new tool and empowering those in the communities to do a work that they are not used to do, and they did it marvelously well. And the same thing happened in the jungle because we were unable to get into the jungle, so we decided to bring the people from there and to work with them. So we worked with them, we trained them, we gave them some homework, and then a month after we came back and we asked them, how did it go and what were your needs and etc. And I think once again that this was a great opportunity to see what were the strategies that can work well.